So West Nile virus is a mosquito-borne virus that is maintained within a bird-mosquito cycle that sometimes goes outside of this cycle to infect humans. So in humans, when they become infected, you get sometimes a mild disease which is called West Nile fever, or in some severe cases you can get meningitis or encephalitis. So the focus of our study was to look at the long-term impacts of West Nile virus. So we studied using a systematic review the outcomes of people that were infected with West Nile infection. So we looked at the incidence of these long-term conditions, the prevalence, how long they stayed within the hospital, what their outcomes were after they were discharged, and also some of the risk factors that can lead to severe illness or even death. So we're really hoping that we can educate the medical community about the severity of West Nile infections and also aid physicians in managing these long-term conditions, including trying to improve the quality of life of their patients, their life expectancy, and sometimes their functionality. The study of insects are very important to public health because of the severity of diseases that they can cause. So mosquito spread, chikungunya, West Nile virus, St. Louis encephalitis, and these diseases are always rapidly changing. We must understand them to better identify people that are in the community at risk of these infections. So in Ontario, we are quite well positioned to understand a lot about the mosquitoes that we have. We've been doing surveillance, identifying these mosquitoes now for over 12 years. We have a good idea which ones are spreading West Nile virus, for instance. We know where these are most common, so in that way we can identify neighborhoods or jurisdictions that are most at risk of West Nile virus.